to another exciting time on your number one health program, reaching you from the station of excellence, NTA Lagos Channel 10. Today on Health Watch, we have a whole lot for you. First, on Dr. Love series, Dr. Love will be talking to us about mental health awareness and its effects on our health. And of course, you know that mental health is the foundation of everything that has to do with our health. The way you respond to situations, the way you feel at a certain time, you really need to know how it affects our health. And Dr. Love has done a whole lot on this segment. Plus, we'll bring you a very interesting topic again that affects women. We're talking about endometriosis. Today, Donald Amadi said a whole lot about the causes, about the signs and symptoms, and of course, he also mentioned the treatment option. Plus, Dominic Ajufor is going to be teaching us CPR. CPR is a life-saving skill. CPR is cardiopulmonary resuscitation. It's a procedure that everyone needs to know, regardless of the sector you find yourself. Okay, I recall watching a movie and somebody had just collapsed, and the house help in that house was able to perform a CPR on the man, and the man came alive. So this is one episode you don't want to miss. All of this and more on this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break when we return. First in our lineup is Dr. Love series. Stay with us.
Me, I feel say family planning, it help husband and wife for good health, so that at least they can last. And in the other way around, now to allow the woman and the man to have the children that they can be able to train.
Family planning enyelu di na nwunye aka ka ha dị ime oge ha chọrọ.
Family planning tank pe ni ti tomo bibi ni pe ki àwa àti ọkùnrin àti obìnrin kò yẹ ká bí mo rẹpẹtẹ ju ti tágbára wò ní ká lọ. Tá bá máa bí ó jẹ́ méjì mẹ́ta ká bí kọ́lọ́ ká tọ́ ọmọ wa nítorí bí gbogbo tá ṣe ríǹsì ohun kan wọn oúnjẹ wọn bọ̀ tí wọ́n bá tá bá bí ká tọ́ kó yanjú kọ́lọ́ kó fún wa.
Ya kamata su yi family planning saboda suna rage samun damar ‘ya'yansu su ƙara girma kamin su samu wasu ‘ya'ya su zo gare su. Idan suna yin family planning za su samu sauƙin abin nan gare su. Saboda haka ne ake mutane gargaɗin cewa su continue da ko mace wanda yana da mata ya yi matar shi ta je ta yi family planning saboda ta samu sauƙin ‘ya'ya haifa.
Welcome to Dr. Love series. I'm Dr. Yusuf Ademola Harun, and today I want to talk about mental health, mental awareness, and how mental health affects your health, your physical health and general well-being. So mental awareness is a foundation pillar of your health and well-being. Health, they say, is a state of physical, mental and social well-being, and not just absences of diseases and infirmity. One major thing is that in your mental health or mental faculty, there's something called a psychosomatic condition. That is the way you think and the way your body also reacts. So when you are having unstable mental condition, you notice that you also start having medical conditions that affects your body. So how do you regulate this? Number one, try to make sure that you are not overworking yourself, because working yourself and also thinking too much can affect your mental condition. Secondly is that there's something called bipolar disorder. Some people get overstressed, or some people develop a kind of medical condition that affects their brain, and at a time they are very, very anxious. They develop anxiety. At another time, they develop depression. What are the things that cause this mental health or mental conditions? Part of it is when we are having or experiencing grief or disappointment. Grief or disappointments can come from loss of life, loss of job, or even loss of financial situations. So in these kind of conditions, we may start developing mental health, depression. In other cases, we may even develop anxiety. Between men and women, research has shown that more men develop anxiety and more women develop depression. And there are some people that develop both, which is called bipolar affective disorder, BAD, or bipolar disorder, BPD. So in these kind of situations, it's good that you see a psychologist, you see a psychiatrist to treat you. Now, mental condition is something which is also manageable. Some people, unfortunately, they commit suicide because they are having a mental situation or they cannot discuss it with others. How do we solve this problem? Number one, try to know the cause of this mental illness. Try to resolve it. Try to take adequate rest. Know also that no matter the condition you are in, thinking too much about it or worrying more or showing excessive anger, rage or aggression is not the solution to this problem. Take adequate rest. Check your blood pressure well. Check your blood sugar. Eat well. Sleep well. And you are going to be fine. Thank you very much. I'm Dr. Love and we always love you.
Thank you, Dr. Love, Dr. Yusuf Harun, popularly known as Dr. Love. Thank you so much for that enlightening segment. And the truth is that our mental health, we need to take care of our mental health. If you're going through anything at all, please find it in your heart to talk to a friend, a colleague, a family member. There was somebody that you are close to, that is around you, that you can speak with. I think that's the first thing you need to do in understanding your mental health. Moving on, Donald Amadi has this interview on endometriosis. We'll be right back. Stay with us.
Endometriosis is when the tissue that surrounds the inside of the endometrial lining begins to take place outside of the uterus. So what exactly am I talking about? This is it. In endometriosis, what happens in a regular period flow does not happen in endometriosis, meaning inside of the uterus, the endometrial lining are being shed, then the blood gets to come out, which is what happens in period. But when it comes to endometriosis, outside of the uterus is where the blood gets to flow, and in this case the blood does not go anywhere. Now, what causes endometriosis? There's no known cause as to how it happens, but researchers have seen that at times it happens with women who start period way too early. It happens to women based on genetics. Maybe a factor can be it happens in their family, so the woman can be prone to having endometriosis. Now, people with endometriosis usually complain about severe period cramps while growing up, and mothers get to think that, oh, it might not be anything serious, it's just irregular period cramps. If a period cramp is painful than normal, painful than the way a period cramp is supposed to be, maybe going to 10 and above, you should see a doctor for treatment. You should see a doctor for investigation. Further investigation will help the child to be well diagnosed of endometriosis, helping to rule out endometriosis, helping to save the child from suffering from endometriosis. symptoms of endometriosis are severe pelvic pain, severe period cramps. Now, I'm not talking about the regular period cramps that women do have, which is painful. I'm talking about very severe. It's so severe that it can hamper a woman's daily lifestyle. It can hamper a woman's activity, and this is very severe for a woman. Then the next thing we have is chronic pelvic pain. We have difficulty with having sex, and at times infertility. Endometriosis is broken down into 3 different types. There is the mild, the moderate, and the severe. Based on the severity of it is the way the treatments can be administered. For the mild, there are ways that they can be handled, that they can be given painkillers to attend to it. For the moderate, painkillers can still be given, and maybe a bit of hormones can be administered. For hormonal medications can be administered. While for the severe, that is terrible. For the severe, they have to go on more deeper treatments regarding endometriosis. Endometriosis, is there a cure for it? Well, there's no known cure for endometriosis yet. However, there are treatment plans for it, and there are ways that it can be handled and managed by a medical professional.
If you're just joining us, the program is still Health Watch, and we just watched the interview with Donald Amadi talking about endometriosis, the causes and the signs and symptoms. One of the things I always say on this program is if you feel anyhow, you see any sign that is unusual, please seek medical help. All right, moving on, our next segment is on CPR, cardiopulmonary resuscitation. Have you seen that before? Have you heard it before? Do you know how to go about it? Watch this segment and learn. We'll be right back.
CPR is cardiopulmonary resuscitation. That is basically reviving the heart when the heart has shut off, which is more of a cardiac arrest. So it is important that we do CPR because it's a matter of seconds, and we need to bring that life back as soon as we can. And that needs to be done within 5 and not more than 10 seconds to intervene in order to resuscitate that life so that it can continue to send or provide oxygenated blood to the brain. The difference is the age and the makeup in terms of their physique. You know, the type of CPR you do on an adult, for example, if you're doing just a one-person CPR that you also want to provide breath, you know, for an adult you have to do 30 compression and 2 breaths. You know, for a child you do 15, and you could use 2 hands or just 1, depending on the makeup of the child, and you give 2 breaths. And for an infant, you use 2 thumbs or 2 fingers to do CPR on them. Yes, so to start CPR on an individual, especially when you are not there when that happened, by you that walking into the scene or somebody came to call you, it is important that you don't endanger yourself while you're trying to save somebody. So first of all, you check the environment to see if it is safe enough for you to have contact with that person. Once you're able to establish that, and furthermore, because you're a CPR person, you can do all this almost at the same time. So you survey the environment, see if it's safe enough for you to touch the person, and when you get to the person, you want to find out if that person is what you think is in the situation where you think it is, by asking if it's okay, or if somebody whom you know, you want to call them by name. And certainly if they're not responding, that means they need help, you know. And then you have to activate the emergency response by either sending somebody to call 911 on the emergency, whatever that is applicable to that environment or that area. And if possible, if it is where you have AED, then ask the person to come with an AED, because he may have not, that person may not have slummed where there's an AED. So you ask the person to come with that, while then you check for the pulse at the same time you're checking for the breath. And once you notice there are no signs of life at this particular point in time, it's for you now to go straight and begin compression on that individual. And if it's somebody whom you're not too comfortable to have a mouth-to-mouth contact because of giving breath, you just have to go all the way doing your CPR, doing your compression, which should be between 100 and 120 within 1 minute. And it's not a thing you have to do like macho. You know, it is not you trying to take glory that I resuscitated this person. Those people, those around you, if they know how to do CPR, then make sure you interchange so that you can recover and continue to do this CPR on this individual. Yeah, bystanders has been a big concern to me too, because what's it called, photo op about social media has become so craven by that we pay so much attention to gossip. We basically want to gossip about things. We don't even know how to enjoy our life anymore. Every little thing you want to record, and in most cases, these things you don't even watch them. So when you see a fellow human being that is on the floor, the next thing you should do is to, how can you help? You're sending videos to people, telling them about a situation. Those people who are watching the video cannot do anything from where they are. You that can do something, you're not doing anything. After all, you're not a reporter. So a bystander should find what role they can play. Even if you're not very active, you want to give space. You want to give room to that environment, or even guide people and ask them to stay away so that these things can be performed very well. In case there's an intervention from the medics coming, they still have easy access to get to the place. So bystanders should stay away from just gossiping, recording and sharing those things, and they need to also respect the privacy of the individual or the people that are helping others. Otherwise, a lot of people will stay away from this when they are not too certain or sure of the response of the public. Yeah, for a choking infant and for an experienced CPR person intervening, you know, you have to hold the baby properly and either you kneel or come into a kneeling form where you can have the head of the baby, you know, facing down, and you give some what we call five breaststroke at the back with a view of pushing that choke towards the mouth, you know, which is the goal. After which you turn the baby around and give with the two finger, you're now giving another push to the chest, you know, thrust. You're doing 2-finger thrust or 3-finger thrust to see if that thing will come out to dislodge the choke or whatever the substance that is choking on. While you're doing that, you're watching the mouth to see if the substance is coming out. If it is coming out, you use either one finger to pull that thing out. But if you don't see, don't do any blind search. Otherwise, you might be pushing that thing back. Just continue those exercises. Those things will work, but just continue to do that until that substance is dislodged. First of all, check the environment and make sure that the environment is safe enough for you to touch this person, that this person does not have any electric transmission on his body before you touch the person, okay? And because you will know these things, they are going to happen so fast because you know. So while you are coming, you're already checking. So it's not what you do like this. You basically are checking and everything is happening fast. But because we are going through this level, you first of all check if the environment is safe before you touch this person, and you gently turn the person around. Have a contact by saying, "Are you okay? Are you okay?" Or if you know the name, Yalabaja, whatever you want to do, you call the person by the shoulder. Why do we often do that? We do that in most cases because of the Good Samaritan law as well. That also that you don't have the right to touch somebody except the person gives you a right to, right? So if this person is unconscious, he's not responding, that means you have the right to touch the person. Based on the Samaritan law, that this person needs help. You be sure you are performing CPR on somebody who has to die, not somebody who is still alive and you performing CPR on that person. Okay? And that one, we do it simultaneously with something else. While you are checking that, you're checking if the heart is breathing or is pumping. You get? We are looking for sign of life. Okay? We are looking for sign of life in this individual. But the moment we establish that there is no sign of life, it is now time to perform CPR.
And when we are doing that, let us be sure that we are in very close proximity to that individual that we are trying to save. And when we are doing that, it's not like somebody grinding pepper. Your elbow must be straight to get the force. And above all, your shoulder, you need that support. So it comes like this, you bring it there, and you push. So you go. Just like that. Okay?
And that's all we can take on this week's edition of Health Watch. Remember that I normally say health conscious people live longer. You have a question, you have inquiries, or you love to sponsor us. I know you love to see my face every week. All right, reach out to us on 07060865487 or send a mail to kibenkem@gmail.com. A big shout out to all my crew members, my director, Mr. Yakini, all the production assistants, the engineering crew. Thank you for sticking around. Thank you for ensuring that we do this every week. To come your way again, my name is Nkem Okibe. Join us same time, same station. Till then, see you. Bye.